Vasudevaya Dhanvantaraye Amrita Kalashahastaya Sarvamaya Vinashanaya Trailokyanadhaya Sri Mahavishnave Swaha. These are two shlokas from Sri Vaidyanatha Stotra and Sri Dhanvantari Mahamantra. Namo Bhagavate. Temple Acharyas are doing the Parayana of this Stotra and other Stotras on a daily basis for Loka Kalyana. The PDF book and the chanting video are on the SSVT website. My name is Vasu Murthy. Subramaniam Jayaraman and Manju Shivacharan are fellow volunteers and SSVT board members. We are helping with the technical arrangements. Along with them, and along with the chairperson of the board, Prabhakar Tyagarajan, and the rest of the board members, Acharyas, staff, and our esteemed panel of doctors, we want to welcome all of you to the second SSVT COVID-19 eTownhall with community doctors. We are streaming live on YouTube. The channel is called SSVT Streaming. The video of the program will be available on the YouTube after the event. As the states are reopening after the stay-home period, the country is going through an uncertain transition period. People are uncertain about how to protect themselves and their families during this period. The panel of doctors will talk about the health and safety issues for everyone during this period. Chairperson of the board, Prabhakar Tyagarajan, will talk about how the temple is performing its operations during this period and give some information about the temple reopening plans. Our thoughts and prayers are with everyone who is suffering during this difficult time. We thank and appreciate the doctors here on the panel, as well as all the medical professionals and frontline workers everywhere during this period. Some logistical items for the meeting. You can submit questions by posting them in the Q&A window. Due to the number of participants, we will not be taking questions by audio. We have received some questions already. We'll be starting with those questions. There will be about 30 minutes of presentations followed by Q&A moderated by Dr. Shiva Subramaniam. Chairman of the board, Prabhakar Tyagarajan, will also give some updates about the temple operations and reopening plans. I want to introduce Dr. Shiva Subramaniam. He is Professor of Pediatrics and OBGYN at the MedStar Georgetown University Hospital, Washington, D.C. He is also one of the founder trustees of the Sri Shiva Vishnu Temple. He works with many other community organizations such as Interfaith Council, UHJT Temple Council, etc. With this, I will hand over control to Dr. Shiva Subramaniam to introduce the panel and take it from there. Dr. Shiva Subramaniam.
Thank you so much, Vasuji. I appreciate your introduction. And I think this will be a very important timing in terms of what the physician panel are going to address, as well as the chairman of the temple will be addressing it soon, because we are now, as opposed to the last time, beginning to open up. Every state is in different stage of opening, and we would like to address where we are from the primarily the DMV area, the District, Maryland, and Virginia. But I know there are several audiences from various other states as well. So feel free to ask the question, and we will try to address it in terms of what additional specific precautions that we all need to take. And I'm not necessarily broadcasting or moderating this session from the space. It is just in honor of what happened this afternoon. SpaceX Labs, and the United States government's space agency, NASA, sent a rocket after a long time, a manned rocket. So I thought in honor of that, we will put that background before we start talking about the plain, straightforward in the planet Earth, what happens with the COVID pandemic. It is really an honor and pleasure and to introduce the speakers for today. And Dr. Chetna Rao, she's an internist and from Prima Medicine, and she will be making the presentation of the initial several background slides. Some of you who attended the last one, you will see that there are some of them are still there, but we also wanted to make sure for those who have not seen them, so they get the actual information. So she will be making the presentation. Many of the slides have been updated as well. And then next, we will be talking a little bit about the vaccine, which is a lot of the things that are being talked about, and by Dr. Anu Subramanian, who is a proud next generation doctor who is an infectious disease specialist, who will be talking about the area of expertise and many of the things that you want to know about it. It will be her area of expertise, and she is from Kaiser Permanente. She will be representing herself, in this. And then we have Dr. Revati Murthy. She is an adult pulmonologist, and this COVID disease started as predominantly a pneumonia, lung infection. And so who else other than a pulmonologist can give and address the information about it and give you some answers as well. And the last of the doctors, but not the least, in terms of Dr. Rajagopal Rao Tripaneni, very important because he is an emergency room physician. Many of you, I know you have questions about whether to go to the emergency room or not for non-COVID related reasons. And I think he will be addressing that for your questions as well as by, specific things that you will. And we have also, because of now we are reopening, we have invited the chairman of the Sri Siva Vishnu Temple, Mr. Prabhakar Tyagarajan, and he will be addressing about the plans that Sri Siva Vishnu Temple has, which will apply to many of the temples and places of worship in the DMV area. And since the political leadership are coordinating the stage of reopening pretty closely with each other, so he will be addressing it. And it will be open for questions. But please, as you see the presentation, if you have questions, in the question and answer in the bottom bar, in the Zoom, you will see the Q&A. Please go ahead and put your question and answers in there. There are a few other questions that have already come in through the email. We will address that, and as well as the questions that you put in. And as Vasuji mentioned, it is facilitated only through you putting the questions in the Q&A box, and then we will have the right specialist address this. So with that introduction, I will ask Dr. Chetna Rao to start the presentation. Dr. Rao.
Thank you so much, Dr. Shiva, for that wonderful introduction. And I'm going to start off my presentation. Just getting this ready here. And just for a second. I hope this is visible for everybody. And I'm going to go ahead and start off just by kind of introducing what coronavirus is. I think everybody knows what this is by now, unless we're living under a rock. It's a novel virus, and it was discovered, of course, right now in Wuhan, China. And it's found in animals. It has jumped to humans. And obviously, we're seeing human-to-human transmission, which has led to a lot of problems for us world over. We don't have immunity for it because our body and the immune system have never seen it before. We have seen other kinds of coronaviruses, including SARS and MERS. That's been there in the past, but not this particular one that we have right now. So just going over what the infectivity rate of this particular coronavirus is. On an average, one patient who has COVID or coronavirus infects 2 to 2.5 people. So it's a pretty heavy infectivity rate, but not as bad as some of the other kinds of things which we have seen. The majority of the people, and I'll go over this in another slide, but let me go over the rate of infection. So in terms of COVID and age, there is nobody who is not susceptible for it. However, the number of cases that we see, as you can see in the in red on the left side where the cases are, the majority of the cases are in the age group of between 50 and 59, but also people who are 40 to 49, people who are 30 to 39, and above that are all affected by it. However, when you look at the rate of deaths, the rate of death, of course, is much higher in the older age group folks. Now, what are the symptoms of COVID? The CDC has added a few other symptoms to the ones that we've kind of seen early on. The most common one, of course, being fever, which is seen at about 95% of COVID patients. There are some who do not have that. However, they will have some other symptoms like cough or shortness of breath or difficulty in breathing. Some people can just have shaking chills and severe muscle pain. Some people can have headaches and neurological symptoms. We're seeing a lot of neurological symptoms these days, including people presenting with strokes and other kinds of issues. Sore throat is a common issue as well. A new loss of sensation of taste or smell can be one of the first signs of COVID. Some people can also present with a pink eye. Doctors who are ophthalmologists and seeing patients at a close angle can actually get transmission as well. Some people present with diarrhea and GI symptoms. Again, this is being seen more and more often as well. Now, of course, there are people who will never have symptoms. They will remain asymptomatic and they can still transmit the coronavirus. And that's one of the reasons why we want to have all the precautions that we talk about. Now, who's susceptible to this particular illness? People who are in the older age group, everybody's susceptible, but there are some people who are more susceptible. Older age group, as we saw from the pie chart before, are definitely more susceptible. Other comorbidities that they have found, which is causing a higher amount of susceptibility, includes diabetes, people who have lung problems like asthma, COPD, other kinds of lung problems, anybody who's a smoker, and anybody who's got autoimmune diseases, people with cancer, people who are immunocompromised, they're all highly susceptible. Healthcare workers and other frontline workers are also highly susceptible. One more category of people who are susceptible are people who are obese. There is a higher susceptibility that's been noted in them. Of course, you've also probably heard about African Americans and them being more susceptible. There's no genetic susceptibility as such, but mostly we're thinking it's in terms of the socioeconomic status. Children less than 1 year of age and people in the 16 to 25 year age group, we see more hospitalizations. The danger signs, this is important to know because you want to make sure that you're getting the appropriate or proper care when you have these issues going on. So number one is trouble breathing. If you're having difficulty catching a breath, if you are not able to count to 10, for example, then you definitely should be taken care of. You should ask for help. Persistent pain or oppression in the chest is another thing that you need to be careful about. Any new confusion, inability to arouse, for example, somebody you think is sleeping and you go and try to check on them and you're not able to make them wake up, that is definitely a danger sign. Anybody with lips which are turning blue in the face or lips, both of those, that's of course another danger sign. If you're having palpitations, if you feel like your heart is racing, super important to get checked out as well. Now, who should get tested? Now, these guidelines keep changing depending on the availability of testing. Now, mostly in the DMV area, we do have a pretty significant increase in the testing capacity. So people who are hospitalized and symptomatic, healthcare workers, people who are symptomatic in nursing homes or nursing home residents, people age over 65 with comorbid conditions like diabetes, lung problems, immunosuppressed, they all need to get checked. People with mild symptoms, which we went over, like fever, chills, a sore throat, new onset of a difficulty in smelling, tasting, those people need to get checked out as well. Anybody now that we're opening up, we're having surgeries which are, scheduled already. People who, it's not an urgent issue, but for example, a knee replacement surgery, they're called pre-surgical patients. So they're all getting checked as well for COVID. The reason being that obviously we don't want to have any patients who are positive and undergoing surgery is putting a high risk to the anesthesiologists and also the doctors who are in the room performing the surgery. So we want to be extra careful about that. Sorry about that. I don't know why that's happening. Going back to the next slide. I apologize. I don't know why this is jumping. Any pregnant women admitted in labor and delivery also need to be checked for COVID as well. Going to the next slide. How does coronavirus spread? Most of the spread that we see is from people to people, a close contact. So if we're in a room together, anybody who's within, especially within 6 feet, is a person who's going to be affected the most. It's due to droplets, respiratory droplets. Contaminated surface, as per the new CDC guidelines or new CDC findings, say that it's minimal. For example, you get cardboard box delivered from Amazon, for example, the contamination supposedly is much lesser with that. However, if somebody is in a closed room together within 6 feet, that's where you get the most spread. And this is just a slide to illustrate the same thing. Anybody who's within a smaller distance will get a higher risk of getting the virus. Anybody who's farther away has a lesser chance of it. However, there are exceptions to this rule. For example, if somebody is coughing, then the droplet spread can be farther. And this is one of the reasons why we're suggesting for people to use a face covering or mask in that situation. How do you protect yourself? These are mostly common sense, but again, important to repeat over and over again because we forget these things. Washing your hands is very important. Up to 20 seconds, you have to make sure that you're washing your hands really thoroughly in between the digits, everything. Hand sanitizer, carry with you, especially if you're outside and you don't have access to water or soap. Avoid touching your eyes, your nose, and your throat. Any kind of contact with sick people, try to avoid that as much as possible. If you have any kind of comorbid conditions, especially, try to stay home as much as possible, even with the opening up, and we'll go over that in just a few minutes. Stay 6 feet away. That is, I'm calling it physical distancing rather than social distancing because we're still socializing, but we're physically distant from the other people. Cover your nose and mouth with a cloth mask while outside. Cover your coughs and sneezes. Sneezing into the elbow, like they teach in the elementary schools here, is very important. Clean and disinfect thoroughly all the touch surfaces daily. These are all some very important ways to protect ourselves. Now, about running errands. Now that we are opening up in different phases in the DMV area, especially phase 1, try to keep the orders still online as much as possible. Curbside pickup if possible. Wearing a mask out in public. Cloth mask is fine. Those can be washed and reworn. Disinfect the handles of the cart while shopping. Most of the places have those available now and you can use those. Spend the least time inside the stores. Indoors, the spread is higher. Outdoors, as long as there's social distancing, lesser. Avoid touching the phone. Phone is always something that you are carrying near your ears, carrying near your mouth, carrying near your eyes. So just avoid that as much as possible when you're outdoors, or use the speaker function. Use the touchless payment system like a credit card or Apple Pay or other kinds of things as much as possible. Running errands, for example, going to the bank, pumping gas, using the pharmacy, etc. Online banking as much as possible, but if you need to go to the bank, go to the ATM, clean and wipe before using. Use a hand sanitizer after collecting mail. Use gloves or disinfecting wipes for pumping gas. Online or phone orders for the pharmacy and delivery. Almost all the pharmacies, at least in Virginia and I'm sure elsewhere, are delivering medicines for free now to all customers and sending them to their home. Another thing I found out also is that we have the UV sanitizers, which we can use for disinfecting phones, for example, and other kinds of things as well. So if you're sick, if you have mild symptoms, these are the things that you need to be doing. Notify your physician. Monitor your temperature daily with a thermometer, and anytime you have a temperature which is higher than higher than what you're expect. 100.4 is what we say for adults, and Dr. Shiva will talk about the children. Important to notify your physician, maybe get tested if it is appropriate. Stay in a separate room with attached bathroom if possible. Stay hydrated. Drinking fluids and staying hydrated is very, very, very important. You can take Tylenol as needed. Ibuprofen is okay as long as you don't have any contraindications to that. Wash your hands often. Avoid interacting with other family members, especially the elderly or somebody who is at high risk. Any immunosuppressed people, etc. Testing sites for COVID. This is a very busy slide, but it should be available online. And I think the organizers are also going to put it up on the website. These are all the resources for COVID testing. This is not a full amount of, not a full list by any means, but it's the start. And also important thing is to call your physician if you have any kind of questions, if they should be able to help to guide you. But WTOP website is the new one, and you can definitely look that up and get some testing done. A lot of places are now open on the weekends or on other times to do free testing with or without a prescription now. So post-COVID recovery, what are the things that you can experience in patients who've had COVID, who've been admitted or maybe not admitted to the hospital? Shortness of breath is one of the things that we are seeing, and these can persist for several weeks afterwards. Palpitations or heart racing is another one. Neurological symptoms, people can have stroke and other kinds of issues associated with COVID. People can have liver damage associated with it, kidney damage associated with it. The kidney damage could be also associated because of the blood clots that's seen in COVID these days. Fatigue is another very, very common thing. Now, going to the emotional impact of what COVID is causing in a lot of people, whether they have COVID or not. Isolation is one of the most important things. I'm seeing as a primary care doctor, a lot of people are having features of increased anxiety or increased depression being seen because of the way that we're isolating ourselves or because of not being able to meet friends or family. Anxiety of infection is another thing, because we're worried about going outside and getting infected because we are hearing about our neighbors or our friends or our own families getting affected by this. Worsening of your underlying problems because you've not gone to the physician, not gone and taken care of your chronic problems. Like one of the important things we see is that a lot of people I'm seeing have had worsening of their diabetes, maybe because of less amount of exercise they're getting, or from the stress associated, or increased cooking and eating at home, all kinds of things like that. Increase in domestic violence and child abuse, unfortunately, has been noticed quite a bit. And there's actually reduced reporting of the child abuse because children are not being seen in other contexts other than at home. So this is an important thing which we have to keep our ears and eyes open as good neighbors and people. Interpersonal relationship issues, again, same issues because of being in close quarters and having situations where we are maybe working from home or having to change our ways of doing things. Now, this is one of the things that I wanted to talk about because of the opening up right now. Doctor and dentist appointments. Most doctors and dentists in the area are now open. Wear a mask when you go into any of these offices. Follow the instructions that is given by the staff. Some of the physicians and dentists also have information that they're emailing to patients, or it's on their website. Please check that also. This includes staying in the car or staying in the parking lot until you're called for your appointment, getting your temperature checked at the door, using a hand sanitizer, physical distancing, etc. Please let the doctor or dentist know ahead of time if you're running a fever or if you have other symptoms of possible COVID that we went over in the earlier slides. Please let the office know if you have been diagnosed with COVID before or after making the appointment, if you've had a diagnosis of this, they will maybe want you to be seen by a virtual visit or a telemedicine visit. And they may have other things that they need to do. So reopening phase one. So we in Virginia, we are at phase one. I believe Maryland as well at phase one, and DC is soon to reopen as well. So the reasons that they're talking about phase one is they have to meet certain criteria before opening up. And that includes the several criteria, but mostly includes making sure that there's enough testing available, making sure that the healthcare workers have PPE available, making sure that the hospitals have availability of beds in the regular wards as well as in the, especially in the critical care wards and stuff like that. So those are some of the criteria that they use to do the reopenings. So in the phase one, they're calling it, at least in Virginia, they're calling it safer at home. And this includes staying at home if you do not have to go out as much as possible, especially for people who have a lot of comorbid conditions. Now, what do you do when you're outside? At the outside, you still have to do physical distancing. That includes at least 6 feet away from other people who are not your family members. Second one is still teleworking if possible. If your office allows it, still do teleworking as much as possible. Using a face covering or a mask in public places, and remembering that businesses have limited capacity. So limited capacity includes making sure that they have decals on the floor saying 6 feet apart from each other so that you're not in another person's space, making sure that there's not too many people doing shopping or other kinds of things in a closed space at the same time. Gatherings, if you are having a gathering at home, try to have it outdoors as much as possible. And they're suggesting to have gatherings of less than 10 people and continue to do physical distancing as much as possible. Going to the gym. Now, gym indoors are not open. They're only outdoor activities available at the gym. For example, if they can do yoga outside, doing that is possible. And any kind of classes which with physical distancing is allowed outside, but the indoor gyms are not open yet in phase one. Restaurants, again, in the restaurants as well, there are a lot of restaurants are trying to adapt to what's going on. Of course, they're still doing takeouts and delivery and things like that. But in addition to that, some of them, especially those which have spaces, they are open and they have outdoor seating. For example, yesterday I went out with my husband and we had outdoor seating, but we also had physical distancing with the other customers there, and it's confined to less than 4 people per seating in the particular restaurant we went to, and I believe that's going to be the case at most of the restaurants. And it'll be outdoors, like for example, if they have an outdoor space or on the sidewalk, for example, things like that. And all the waiters are using masks, for example. So they're trying to adapt to what is going on currently. Daycare is being made available for essential workers. And also there are restrictions regarding that, as well as to the number of children that they can have in different age groups and the number of providers that is available as well. Regarding the temple, Shri Prabhakarji will speak about it after the presentation from the physicians is done. And I'm going to turn over the rest of the slides.
Dr. Chaitanya Rao, I have one question to you before you turn it over to Dr. Subramaniam. This is directly what you had talked about. Thank you so much for a great presentation. And it was really very informative, and particularly with the reopening, you have addressed a lot of questions in the people's mind. But there is a question here: with most primary care physicians not seeing patients in person, you addressed in one of your slides, how do we go about taking care of ourselves? I mean, individuals, patients themselves. And it looks like the COVID will be staying here for some time, and it looks like we have to live with it. How do we address our problems? As a primary care physician, you are probably the best person to address it.
So some of the doctor's offices are open. A lot of the doctor's offices have scaled up to do a lot of televisits and virtual visits. So obviously they cannot do an examination there, but some things, for example, being able to see the skin, for example, diagnosing different rashes and things like that, knowing if somebody has shortness of breath, those are all possible. Definitely COVID testing, they can write for and all that. And you can go to the lab and get some of the lab work done. If you do have chronic conditions like diabetes, please talk to your doctor. Even if they are just doing virtual visits, you should still be able to talk to them. If you have a blood sugar monitor at home, please check that daily and inform your physician. They may have portals available so that you can use the portal and get that information to them, talk to them, things like that. Make sure that all your medicines are refilled. Most of the doctor's offices, especially if they are not open full-time, are willing to do the prescriptions for you. Do not run out of your medicines. It's very important to take all your blood pressure medicines. Don't stop any of those medicines without discussing with your physician. Don't stop any of your diabetes medicines either. Get physical exercise at least 30 to 40 minutes a day if you can. That would be really good to do to be able to keep yourself healthy. Wear a mask when you're outside, walking on a trail or doing something similar to that. Also make sure that you're eating healthy. Continue to do that even when you're at home. I think those would be some of the most important things to do. Of course, be in contact with your physician and follow their advice.
Thank you so much for that. And I know there are already several questions are coming up. I just want to continue the presentation, but for you, I think there is one other question that is there about follow-up. After a patient who has a COVID was in the hospital and was discharged, what kind of a follow-up you do? And do they have any social workers or home visitors to help them at home?
That's an excellent question. And depending on the amount of symptoms they have and what their presentation was and all of that, we do a lot of follow-up for them. For example, I have a patient right now who's a nurse and still having problems after 4 weeks of being out of the hospital. They still have shortness of breath and palpitations. So it depends on the severity of the illness. And I'm sure Dr. Revati and Dr. Anu will address that in just a little bit as well. And it is important to do follow-ups with your physician, and it's important to make sure that they talk to you about when you can go back to work. There are different regulations regarding that, and we'll touch upon that later on in the presentation as well. And those guidelines do keep changing quite a bit. They have changed since the diagnosis, since COVID became widespread in this country. So, it's important to definitely important to go ahead and follow up with the physician doing virtual visits or a regular visit after the period of infectivity. And there is a lot of resources available. There are home visits available. There are social service visits available. And there is a lot of help available, including from the hospital and from your primary care physician and specialists.
Thank you very much. Then if you can turn the next slide. We'll invite Dr. Anu Subramaniam to talk about vaccine, which is a popular topic right now, and probably a lot of misconceptions about the vaccines. So with that, Dr. Subramaniam, could you address this?
Yeah, so I know this came up with the previous discussion, but essentially, I want to just go over a little bit about what a vaccine is. I think most of us know that right now, our biggest hope for dealing with COVID in the long term is getting a vaccine. So I want to just explain what a vaccine is. A vaccine essentially is using a inactivated, weakened, or dead form of a virus or bacteria, and it is putting it in a solution that's stable and presenting it to the body. By presenting it to the body, you are allowing the body to develop antibodies to fight off infection so that the next time that this virus or bacteria presents to the body can make its own antibodies and fight it off. So this is just a slide showing you what the vaccine is and the fact that a vaccine is really using your own natural defenses. It's your body making antibodies to a portion of a virus or bacteria and basically developing your own body's antibodies. It's not giving you anything additional. It's stimulating your body to produce the antibodies. And really, you don't have to worry about getting a virus or infection from the vaccine, because the vaccine is typically a dead virus or an inactivated virus that really cannot cause you to get sick. And the whole purpose of this is the next time that you get the infection, the virus, instead of getting a severe infection, you get a mild form of it, or you don't get it at all. Next slide. And a lot of people are asking the question, why don't we have a virus? Why don't we have a vaccine already? And unfortunately, it takes quite a bit of time to make a vaccine. So in this slide, it just gives you an idea of what goes into making a vaccine. This starts off with preclinical testing, which is really the basic science development of a vaccine, and then goes into animal testing too. And then in clinical testing, there's phase 1, phase 2, and phase 3 trials. And I'm showing you this because you basically are starting in phase 1, where most of the vaccine development is sort of going into, is either in preclinical right now or phase 1. They're testing a very small number of people. So we're talking about 40 to 50 volunteers for the phase 1 trial. And then it moves on to phase 2, which is on the order of a few hundred. On the order of a few hundred people. Sorry.
I know you are on call.
Yeah, I know, I'm sorry about that.
No, it's okay, no problem, please.
So it's a few hundred people, so it's a larger number of people. And so there, initially we're just looking for safety data in phase 1. In phase 2, we're looking to see the efficacy, like is it working, and also some additional safety data. Phase 3 is talking about thousands of people. So it's really a large number of people volunteering and giving them vaccines. And again, they're assessing for safety, but they're really looking to see, is it creating good antibodies? Are they long lasting? So to give you an idea, this process, takes several years, on the order of 15 years if you were doing it perfectly. So I'm just showing you this because we're expediting this. So the idea is this whole process, taking less than a year is very difficult. So on the fastest scale, it's really more like a year, not less than that. I know we've heard a lot about, looking at 9 months, but realistically, it's unlikely for a vaccine to really be ready for use before spring. So I just say this because while we're all hopeful that this will come soon, we do have to be patient because this process takes a while. We want to make sure that the vaccine is safe, and we want to make sure that it works before it's available for everyone. I think on to Dr. Shiva.
Right, but I just, let me ask you a question that just came up to you directly. Can a person who has never taken any flu vaccine in the past 10 to 12 years and never gotten flu venture to take COVID-19 vaccine whenever it is ready?
That's a good question. So when it is ready, the answer is yes, because the idea is that the vaccine would have been tried out on several different people. For instance, in phase 1, we're using very healthy people who don't have a lot of medical issues. But phase 2, we include everyone. So those with immune issues, those who have not gotten a lot of vaccines, sort of a variety of people. And then phase 3, the same. So yes, I think it would be safe. We'll have to wait and see what the data shows for the initial vaccines. I have had a lot of colleagues and patients both asking, when the vaccine is ready, should we use it or should we wait? And I understand the skepticism, I get it. And I do think, I'm not saying I want to be the first one in the line to get the vaccine, but I think it's important to understand that for it to go through the process, they really would have to feel that it's safe to be able to deliver it to patients.
Thank you so much. We'll come back to you with more questions later. If I can have the next slide, please. And I think there are already a couple of questions about pregnancy and neonates, and some of it will be addressed here, and others we will address it in the question and answer session. Please go ahead and put your question and answers in the Q&A box, and so we can take that after the presentation. I'm going to go through this very quickly. So far, the data from the different countries suggests the pediatric coronavirus disease might be less severe than cases in adults, and the children might experience different symptoms than adults. And the adult symptoms Dr. Chaitanya Rao went over, and the pregnant women may have the same risk as others. So there was a question about that as well. They will have the same risk as any other adults. And so they use the same precautions of all the suggestions that Dr. Chaitanya Rao gave. Whether you are planning to conceive or whether you are pregnant, use the same precautions. In the preliminary descriptions of the pediatric COVID-19 cases, relatively few children were hospitalized. Even now, if you look at this, the total number of patients admitted, it's less than 1.5% of the patients who are admitted to the hospital are pediatric COVID-19 patients. And so it is small, but some of them can get sick, and a very small percentage get admitted to the ICU. Again, in the total universe of COVID patients, it's a very small number. But not that they don't get sick, they do. In general, they may not have the fever and the cough as the predominant symptoms. Less than 50% of the kids will have that, whereas 80% of the adults have the fever and the cough. And this, as I mentioned, severe outcomes were rarely reported, except recently, there is a series of presentations of 100 plus cases from New York of children with affecting the multi-system severe disease. It's like Kawasaki-like disease, and with some serious outcomes in those children. That is the recent information, whether it is because there is a mutated version of the virus is now evolved, or is it because of the underlying issues of comorbidities, with the children who have this, especially the obesity, asthma, or something to be, resolved as we get more information on these things. But even though the patients, that is particularly children with less serious illness and those without symptoms, asymptomatic kids, they may not be much of a problem, but they play a very important role in the disease transmission. And also you have to remember, in infants who is born to mothers who are COVID positive, there is a potential for the baby's stool could have this virus with fecal oral transmission. So when you are changing the diapers, you need to take care, in terms of, again, washing hands before and after is the most important thing that is necessary. But do change the diapers, please. Next slide, please. In the literature, now there are 2,500 plus cases that have born to COVID positive mothers have been reported, many from United States as well. But it looks like the neonates, if immediately after they are born, are not infected. And even those few cases that were shown had COVID positive are usually asymptomatic. And some of the symptoms of the respiratory disease that we see in these babies and is usually because they are born premature or in regular infection, sepsis. And so it's evolving. We will know more about it in a few months as to about what happens to the infants and children. Whereas less than a year old, older infants do have a little bit more serious disease than the middle age children. Next slide, please. In terms of the pregnancy, I'm just going to quickly give you, next slide, yeah, thank you. The WHO guidance, they recommend mothers and infants after the delivery should be enabled to remain together in the hospital, and they should take care of the babies as they would have otherwise, including rooming in throughout the day and night. But with all the precautions that we have recommended, in the next part of it, you can see the in terms of practicing the respiratory hygiene, not coughing in, having a mask all the time you handle your baby, and including when you are breastfeeding the baby or bottle feeding the baby, you have the mask, and perform hand hygiene before and after you pick up the baby and feed or handle, hold, and also routinely clean and disinfect surfaces on which you put the baby or you touch. And so this is something very important. Unless the mom is severe infection, in which case you have to separate the baby and the mother. Next slide, please. So the American Academy, the one point I wanted to make quickly before WISE AAP has a recommendation, the babies get their antibodies that Dr. Anu Subramaniam talked about, primarily from transfer through the placenta during pregnancy. If the mom is infected or vaccinated, they have antibodies that they can pass through. So in COVID positive mothers who are delivering, they will produce antibodies that would have crossed some to the babies. And so that is important to get that. But after the delivery, it comes primarily from the transfer of the fresh breast milk that is from the mother. And so, and further for first 3-4 months, the breast milk is the most important to pass the antibodies to the baby. And that's probably why we don't see as many babies get infected. Next slide, please. The American Academy of Pediatrics, or next slide, please. The American Academy of Pediatrics are recommending separation of the babies, as opposed to the WHO, who feel very strongly that there is minimal evidence that the pregnant women are passing it on to the fetus or the baby, even though there are 1 or 2 babies have been reported. And so they should be encouraged for all the antenatal postpartum care as appropriate. The obstetricians will address that. Most of the antenatal appointments are kept. Some of them are done by telehealth. You need to have sonograms as appropriate. And so any additional care, because if you have gestational diabetes or any other problems, you have to take care of it like any other pregnancy. Next slide, please. And in terms of the baby management, the American Academy of Pediatrics in the United States recommends separating the mother and neonate in many situations after they are born, but now seems to agree with staying the baby and mom together in the hospital as a shared decision making. That means if the parent wants the baby to stay with them, that should be allowed. And from my perspective, I go with the WHO recommendation. And as long as the mom is not very sick or the baby is not very sick, that if the parent wishes, the baby and healthy baby and the reasonably healthy mom with COVID positive can room in together and take care of the baby. In fact, this is the great opportunity for us to be able to teach the parent how to take care of the baby with all the precautions. Next slide, please. The key takeaways in terms of the pediatric pregnant women is, obviously, this is the most unprecedented challenge for all healthcare systems worldwide. And there is no specific treatment and nor vaccine that exists to date. The treatment, remdesivir, is partially effective if given early in the disease in the hospital. It is given as an IV. And more medications are being tested. And this can be addressed by Dr. Anu Subramaniam later. Pregnant women have similar issues like other adults. They do get. In fact, when they come to present for the delivery, we do the test all of the pregnant women. 15% of the women who are presenting to the delivery are asymptomatic. And that is why we want to check and make sure how to take care of them and help them. and many of them have milder disease. The children may be affected, but not usually the babies. But even the children who are affected are less severe, but they can be carriers of the virus. You have to remember that. And the babies and children have more gastrointestinal symptoms. And so the fecal oral transmission needs to be kept in mind in the children and the adults taking care of them. So far, there is very minimal evidence of vertical transmission. It may come up later on. There are 1 or 2 case reports are there. And if the babies do get sick, some of them get mild to moderate forms of the disease. Next slide. Do you want to handle this, Dr. Chetna Rao?
Yes, sir, Shiva. So the key takeaways for reopening on phase 1 is still basically safer at home. So just don't go about carrying out as if things were pre-COVID. We're calling it pre-COVID now, but make sure that you are staying at home as much as possible. Of course, you can go out for a walk. Make sure that you're wearing any kind of a face covering, a cloth mask, something like that when you're going out. People who are at high risk, again, stay at home as much as possible. Of course, nobody wants to stay home all the time, but do take the precautions, stay with physical distancing of more than 6 feet, try to stay away from centers like malls or high concentration of people, try to be common sense about this. What supplies do you need to carry when you're outside? Try to carry some wipes with you, try to carry some hand sanitizer with you, and of course, keep your cloth mask handy, maybe have an extra one on hand if there's any issues. Travel, I know there's going to be quite a few questions about travel and possibly about grandparents and meeting grandchildren. I think we're going to address that in just a little bit in the question and answer session. In general, for travel currently, of course, if it's in your own car and you're traveling to a place where there's no high amount of cases that's there and you're going from one place to another shorter distance, you could do that. But if you are going in any kind of airplane, you're doing any of that kind of stuff, definitely high risk people should try to avoid if possible. And, be again common sense about it, and be very, very careful when you're traveling outside of your home about using public transportation and things like that. Again, very, very, very careful with any of these, because unless there is some additional things that we're going to see, for example, a vaccine or things like that, we cannot be 100% sure. We have to take all the precautions that you can take. I'm going to hand it back to Dr. Shiva right now. I think we are done with the presentation, and we're ready to take some questions now.
Yeah, there are already, before we go to address about, some people have asked about temple opening, I'm just going to ask the panel for some of the questions that have been asked already. And so, please address that. Let me, okay, there are a couple of questions I'm going to answer with reservation. Some as is it possible to get information from India about the Ayurvedic and homeopathic remedies they use for this virus and provide to your listeners? And there are some breathing techniques. Let me just say this. First of all of us here are allopathic doctors, and we are not experts in terms of Ayurvedic or homeopathic or Siddha medicine. But having said that, I can address some of the information that is available. Not that we are making any recommendations, but I think it is something that people have made recommendations. Some of them have a physiological basis. Let me give you a couple of things. One is taking vitamin D is now been, at least keeping the vitamin D levels in your body normal seems to help. Those who are vitamin D deficient, it seems to have a little more severe disease of the COVID. Same thing about vitamin C as well. And zinc is something that supplementation is helpful, especially, as many of you know, some of the presentations of symptoms of COVID-19 disease is loss of smell and loss of taste. And zinc plays a major part in those two areas. And so that is something that is also as a supplement has been recommended. And in terms of Ayurvedic, turmeric and pepper are two anti-inflammatory agents that have been shown to have general anti-inflammatory effects. Nothing has been shown specifically against COVID-19, but this is something that is taken very commonly and given by Ayurvedic physicians. The other technique with Dr. Chaitanya Rao said about the emotional aspects of it, and there is some aspect of it as, I don't know what Dr. Anu Subramanian will say, but some immune boosting aspects of it is meditation. Meditation has shown to help in terms of general help in terms of psychological, emotional help. And also they have published papers about some immunomodulation is also possible. The same thing about pranayama has also been shown in terms of breathing techniques. And there are many breathing techniques that are there that helps. And this, again, Dr. Revati Murthy can address with taking deep breaths and improving oxygenation has any effect. I don't know, but it is good for you psychologically and emotionally. And as well as yoga is another thing that has been shown. I just wanted to address those things because that questions keeps coming and asked. We are not making recommendations, but we just wanted to make sure. This question is next to I probably will ask all the panel members, what are the long-term effects of COVID after being discharged from ICU and having been on a ventilator for 3 days? Should they be quarantined until the cough stops, even after the discharge? Or what is the issue? Who wants to take this first?
Dr. Shiva, I just wanted to say, can you please turn on the video? There you are.
Yeah. It just came on, yeah. Who wants to address that after they are discharged from the hospital, they still have a cough. When are they actually, don't have to quarantine or isolate?
So maybe I can answer that question.
Please.
What we are recommending basically is it runs its course anywhere from 2 to 3 weeks. And if they've been sicker than that, if they've been in the intensive care units, they'll stay in the hospitals even longer. So in general, now in our program, we've had a couple of residents who turned out to be positive. And basically what we said was quarantine yourself, isolate yourself for about 2 weeks. And if they're still coughing, the idea is that do we go back and test all of them? Ideal situation would be we should retest them and see if they're still positive for the virus. And if you're not testing them, then a good period will be about 2 to 3 weeks that they should basically be in social isolation or self-isolation. They still have a potential of infecting. Now, I would like for Anu to add to that comment.
So I think you bring up a good point that it depends. As a general rule by CDC guidelines, you need to be fever-free for 3 days. You need to have improvement of your symptoms, and it needs to be 10 days or more from the onset of symptoms. At that point, if you've met those 3 criteria, you can basically be out of your self-quarantine. And again, what that means is a little bit different for different people. For most people, that means going about their business, taking walks, going outside, running an errand with a mask. For healthcare workers, it's a little bit different. For healthcare workers, it's the same criteria, but they would continue to be very vigilant about wearing a mask at work, whether they're in the office or a hospital. So we would continue to wear a mask for 14 days. And I would say for everyone, it's really, you can be out of isolation at 10 days, but you would continue to wear a mask out of caution. If people are very sick in the ICU, there is data that they tend to shed the virus for longer. And so it's in those people that we don't have an exact number, but we push that to the 2 to 3 week mark in terms of isolating. So it does depend on how bad of an infection you have. So if you had severe COVID versus a mild COVID infection, the vast majority of people have mild COVID infection, in which case you can, again, go back out of isolation and sort of into a modified social world at the 10-day mark, as long as your symptoms are better. I do have some patients whose symptoms persist, and it's more than just a mild symptom. It's a kind of a very, a symptom that's very bothersome. And in those patients, I'll tell them to quarantine for a bit longer. So you sort of have to meet all those 3 criteria.
Thank you. Thank you very much. I'm going to ask the responders to be brief because I have so many questions. I just don't want to miss those questions. So please give brief answers, and then we can put more elaborate answers in the question and answer and put it in the website as well, so that we can make sure we can address that. Quick question. The flu vaccine, should it be taken in this coming flu season in October? Quick answer, Anu.
Yes.
Thank you, because I think this is important. Let me add to that as a pediatrician. This is something that we are extremely concerned and worried that many of the parents are not bringing the children for the regular vaccine that they need to take. This is extremely critical and important because we may get measles again as an epidemic, which is much more serious. And so please, please, please call your pediatrician. They have very specific arrangements in terms of quickly get you in and out to get the vaccines. So please get all the vaccines to your children also. The next question. You already answered that. The slide, the information will all be presented later on in the website. We have noticed varied death rates, young and old. Is it because there are different strains, or is it because the extent of exposure to the virus? Who wants to address this quickly? Old age, comorbidities, and high rate death rate.
So we don't know why some people are affected more than others. There's probably some factor that we don't know of why one 50-year-old gets very sick and another gets no symptoms. The biggest thing are comorbidities. Additional comorbidities at advanced age, and advanced age is not an insult, it's anyone over the age of 65, you would be at higher risk. So I think that's important to think about. You may get it as much as a 50-year-old as a 70-year-old, but you're more likely to get very sick with it.
Can you also, while you're on, can address about the antibody testing, Anu?
Yes, so the antibody testing is actually quite controversial. Most of the antibody testing available right now is actually not very good. When I say that, I mean the rate of false positives is still unacceptably high in my opinion. So that means you could get an antibody test positive, feel good that you have antibodies and protected, but in fact you actually don't. So right now I would be very cautious about getting antibody testing because interpreting an antibody test is difficult.
Dr. Anu, can I ask a quick corollary to that? Some of my patients are asking me that, for example, if somebody has had COVID and they've been hospitalized, it's diagnosed as COVID, can antibody testing help them in order to donate the plasma?
Yes, although nowadays most places are taking convalescent plasma from people without the antibody testing. What they're doing is they just want to make sure that they had a positive COVID test in the past and that they're 14 days from the onset of symptoms. So they used to do a screening test that you have to be COVID negative to donate. They've actually changed that a little bit. But the antibody test does not help much for that purpose. It's not used in that way. And I will tell you, there's a few select group of people in which the antibody tests are helpful for. And I'm just going to give you 2 examples. One would be someone who's going to maybe need chemotherapy for a cancer, or a specific situation where someone has to travel, like military. But as a general rule, it's not it may become a useful test. Right now, it's just not that accurate to be helpful.
Thank you so much. I have one more question that I want to ask Dr. Thirupaneni Rao. There is a lot of people who don't want to go to ER, and they have letting their health, be affected. And would you want to address that question, because they have not because of the fear of the COVID?
Namaste. Yes, you should not be afraid to go to the ER or urgent care if you have significant symptoms. As far as the COVID is concerned, if you have fever, shortness of breath, or vomiting, which are persistent, you should go to the emergency department. Probably that's better. If you are sicker, the better you go to the emergency room rather than an urgent care, because you end up going to the hospital anyway. And also, if you really can't breathe and you're turning blue, your lips are turning blue, fingers are blue, please call the 911. Okay, they will take you to the proper place to be taken care. Don't be afraid if you have normal uncontrolled diabetes or chest pain, which may be a heart attack, or difficulty breathing, or any other medical problems. Normally you would go to the emergency department. You should not postpone that. You should go to the emergency department to get proper care. Especially nowadays, emergency rooms are more or less empty, half empty, I would say, because people are afraid to go to the emergency rooms. So please wear a mask when you go there. If you are going, somebody leaving you near the emergency room with a car. I hope I answered the question.
Thank you so much. And there is the next question is, when would the temple be open? And with that, let me pass that on to to Prabhakar Tyagarajan, the chairman of Board of Trustees of Sri Siva Temple, and as to what plans they have. And then we will come back where Dr. Revati Murthy is going to address a few points, and then open up for more questions. So please go ahead and put the questions in the Q&A box, and we will answer it in the box itself, as well as address it later. Thank you so much. Mr. Prabhakar?
Yes. Namaste to all, and good evening. I hope all of those listening in to this town hall are doing well, healthy, and safe, and your families are all doing safe. I guess the question that has been posed, and I think there's some other things that I think we were going to talk about, but the immediate question that has been posed is to when is the temple reopening? And now, for all of us, visual thinking would be that, well, we'd like to open as soon as possible, but there is a reality that we have to deal with. The Temple Board of Trustees understands very clearly that, it's very important for us to, as a service to our devotees, for whom it's an emotional and spiritual need to be able to come to the temple and do darshan and so on. So we would like to, try and facilitate that as soon as possible. However, we have to take precautions. And a lot of the precautions that the temple is going to do is going to be along the lines of what you heard Dr. Chetna Rao mention earlier. And in terms of the faces, and this is going to be, for example, the face, it's going to be in sync in general with the phases of reopening of the county, in terms of what the county does, because and it's going to be specific to Prince George's County, because we have devotees from all over Maryland, Virginia, DC, and so on. But since the temple is physically located in Prince George's County, we're going to follow the guidelines that come from the county in terms of how we're going to plan to open. As you know, the Prince George's County executive, Angela also Brooks, mentioned about that she'll lift the county stay-at-home order. This is announced Thursday. That's that she will be lifting the order on June 1. So June 1 would be the start of the phase 1 as far as the county is concerned. Now, there are some other details to that, but we are particularly interested in what she has to say about religious and houses of worship. And a paraphrase, as for what she said, as for houses of worship, they can open for gatherings of 10 people or less, but otherwise must maintain their online services. As you know, the temple, we have been providing since March of 25th or March, we have been providing online puja services for all our devotees. More recently, for the past 2 weeks, we have been providing specific personal pujas for devotees. Now, all that is still going to continue. We're going to take a very careful approach to this. The county says June 1, plus they have gatherings of 10 people or less. As you know, we already have staff in the temple that add up to that number. So how do we interpret that? I have in the board of trustees, we have 2 or 3 a task force that's working on a detailed operational guidance document as to when, how, and when we are going to do the reopening. I'm just going to summarize in terms of what I anticipate is going to be our reopening, the way we're going to do the reopening. One is that it's going to be, our reopening is going to lag the county by about 2 to 4 weeks. And it's not going to be cold turkey, we're going to open all at once. It'll be a gradual phased-in opening. There'll be more restrictions initially, and these will be gradually withdrawn over time. And we'll be continuing to monitor the pandemic impact, and we're going to look for decreasing impact of the pandemic in terms of the number of cases. For example, for instance, Prince George County, I'm told by the doctors, is a hotspot where we have the highest rate of detection of COVID cases. So, temple being situated there, we're going to be extra careful with that. We're going to look at devotees that are at high risk and who would be looked to visit the temple, take extra precautions before they visit the temple. So in summary, I would say that you're looking at maybe 2 to 4 weeks, probably more towards the mid or towards the end of June is very likely the time that I would, at this point, based on what we know as of today, we'll look to open the temple. Again, this is something that's being worked on, and more details will be available as the days go by.
Okay, thank you so much, Prabhakar. There some additional questions might come, but what I would like to do now is to move back a little bit in terms of some of the medical questions. I would like to request Dr. Revati Murthy, who is an adult pulmonologist, and especially, this disease is it is in their area of expertise, and especially now the temple has been located in Prince George's County, and she intimately is aware of what the situation in PG County as well, as Prabhakar mentioned. I would like to ask Dr. Revati Murthy to make a few comments.
Thank you, Dr. Shiva. This disease, even though we know it involves multiple body system, is primarily a respiratory infection. the target organ that this virus loves to attack the lung. And when it gets into the lung, it sets up a severe inflammatory response. And it damages the lining of the lung. And the symptoms can vary, anywhere from having a mild cough to a sore throat to severe, what we call respiratory distress syndrome. Couple of points I want to bring. First of all is that how can you keep your lung in a good condition or optimum lung health? Okay. Those who are asthmatics, please don't stop using your inhalers. And in fact, keep using the inhaler may even make your symptoms and all the intensity of the disease a little better. So if you need the inhaler, use the inhaler and keep your lung in a good condition. The inhaler should also be kept clean. Wipe the mouthpiece, keep it separately. Do not share inhalers with other people, even though you may have a child who's also an asthmatic at home or a parent, but do not share the inhalers and keep it clean. Secondly, the other things that affect your lung health is one of them is smoking. So this is a good time for smokers to think about quitting. Okay. And the other habits like vaping, hookah, they all tend to damage the lung. And so my strong advice is smoking, all of those things that damages the lung, please stay away from them. And the third point is alcohol. If you know, alcohol does damage the lung. It takes away the ability of the lung to fight the infection. There are little brush like cilia in the lung, and alcohol consumption destroys those cilia, then makes you more prone to pneumonias. And other point I wanted to bring up was that there is an increased incidence of blood clotting with this particular viral infection. So those who have been getting better, those who have been discharged from the hospital, you're home recovering, and if you happen to feel that your shortness of breath is getting worse or you have sharp pains in the chest, please do contact your healthcare worker, provider, and get attention. And the last session we had, there was a lot of question about monitoring your own oxygen saturation at home. And it is very interesting. It's like a double-edged sword. Okay, it's got some points, and so what it looks like, you can get something like this, which is a pulse oximeter. Now it's very cheap. It's like maybe you can get one for $20 on Amazon. But what you need to know is some of the things that will interfere with the true reading. Very dark nail polish will give you a false result. And if you have a red nail polish, it will give you a false result because it is basically a spectrometry. The pigment is what picks up the number. And the other thing is that don't wait for that to drop. If you have other symptoms, don't wait for the oxygen level to drop to get help. Because that may be, sometimes when the oxygen level starts dropping in this particular infection, it drops very quickly. So like Dr. Tripaneni said, nowadays ERs are safe. They have completely separate patients, and do not hesitate to go. But if you are short of breath, if you have pain in the chest, if you have tightness in the chest, you should get medical attention. Okay. So to address the next point Dr. Shiva brought up, yes, this episode we have had Baltimore County and Prince George's County has had a very high incidence of hospitalization and patient death. And we are still running a very high census. So basically Prince George's County just opened the old Laurel Hospital and made that into a COVID center. So as of last 48 hours ago, we still had almost 100, but the two together, we almost had about 100 patients in the hospital. Even though the number of emergency admissions for COVID has come down, and the number of death has also come down, and we are like closer to getting to the 14-day, but we are still not out of the acuteness of the disease in Prince George's County. And that's basically what I have to say.
Thank you so much. That is so much important information that you shared with us, and it is something that helps the people. Even though Anu answered the question in writing, I think it's an important question that if somebody cannot go in the car when the things open up, they have to go back to work. If they have to use public transportation, what do they have? What kind of measures that they have to take? Could you, Anu, repeat this, what you answered, or add to it in terms of those who want to go on public transportation?
Yes, I still think we need to be pretty cautious when it comes to public transportation. If you don't need to take it, I would advise waiting longer. If you do need to take public transportation, obviously wear a mask. Please wear a mask at all times when you're on a bus, a train, anything like that, where you can't really distance from another person. Also, please bring hand sanitizer if possible. And these are just little things like Dr. Chaitanya Rao said, just, pack a little supply kit, sanitizer, your mask, and a pair of gloves. If you do need to do things like pump gas, things like that, it's nice to have a pair of gloves where you don't have to worry too much. You wear the gloves, you pump the gas, and you just throw it away. Just basic precautions. And then obviously with public transport, if you can separate, like in a train, 6 feet away from another person, that's better. If you can't, that's really why it's very important to be wearing a mask, both for others' protection and yours.
There is another question about, in terms of, there's a lot of talk about the second wave. And if so, when do you think it is? It will come? And I mean, we don't know, but at least in terms of educated guess, and how would you address it?
I think most of us ID docs are concerned that there will be a bit of a spike as things reopen. So phase one, we're all very cautious to see what happens with the numbers. So this will unfold in the next week or two. I do anticipate a small spike. I don't think it's going to be a full wave or anything at this point. My biggest concern for a second wave of infections would be for the fall, because the challenge there is we would most of us are expecting to see COVID make another rise then, but we'll be dealing with both COVID and the flu, which is again why I would really stress to please get your flu shots, because dealing with both of these is very difficult, and having a level of protection at least from the flu makes it so that yes, you might be worried about COVID, but at least you've done what you need to for the flu.
Thank you very much. For Dr. Revati Murthy, you mentioned about the lungs and all the issues, and I think especially about the making sure you use whatever you are treating for other things like asthma and all that. The question still comes up in terms of whether, for what symptoms you want to have the patient call the doctor, COVID or non-COVID symptoms, that you would ask the person to call the doctor or go to the ER.
So let's address the common things that we deal with, pulmonologists deal with. If you are an asthmatic, or you have chronic obstructive lung disease or bronchitis, and if your basic disease is getting worse, or you feel like you're wheezing more, you have a productive cough, you don't want to go to the emergency room, yes, please call your healthcare provider. Most of the doctors are available either on tele-platform or on the telephone to talk to you and address the issue. And if you are more short of breath and you feel like the shortness of breath is getting worse, and you have a fever on top of that, And definitely you need to go. It is okay to call your healthcare provider. They can arrange for you to get you tested. But there is what I want to emphasize is that there is no harm in going to the emergency room anymore. I think people are very scared to go to the emergency room, but you do need to go to the emergency room because you will get a full attention. And some of the addresses that need to be dealt with has to be dealt with. Otherwise, if you do have on top of asthma or on top of chronic obstructive lung disease, you also turn out to be COVID positive, your disease could be worse. So that would be my, strong
Thank you.
advice.
And I think just transfers to Dr. Rajagopal Rao in terms of you would encourage people who have like chest pain or other states other than COVID symptoms, if they're serious enough, to come to the ER. Right now there is protection is given, to be able to separate those COVID and non-COVID patients and be able to come.
Correct. I think there are other symptoms like tingling and numbness, or loss of consciousness, or change in mental status. You should, of course, your relatives, whoever is there nearby, should call the ambulance, or that is the best way. If you're unconscious, it's better to call the 911 rather than somebody taken to the ER. That's very important. So the message here is there are non-COVID issues which you should not neglect. That's the take-home message, right?
Right.
Thank you.
Yeah, that's very, very important. People are really worried about in terms of not coming. They are ignoring the serious symptoms of non-COVID things. There is a question from the grandfather. When would be the right time to go and take care of the grandkids? I mean, this is something that is always an issue. I can address this question from both as a grandparent as well as a pediatrician, from that, and maybe Anu can add to this as well. Right now, I think, I had mentioned it, even though the schools are closed and it actually helped to reduce transmission because the children could be transmitting carriers and not very sick. So if no vaccine is available and no treatments are there, it is with abundance of precautions. What I would recommend at this point is to reduce interaction between grandparents and children as well as grandchildren. And it doesn't mean that you should not talk, both in terms of Skype and FaceTime and all that, as well as depending upon the neighborhood, from a distance. I would just say more like 7 to 10 feet separate, and if you want to see it, because we are all social animals and it's very difficult, to be able to not do, but I would be very careful about this interaction. And I know the anxieties from both sides, but I think it is with an abundant precaution, I would say caution. Dr. Anu Subramaniam, would you like to add anything to that?
Yes, I agree. I think it's a challenge because every grandparent wants to hug their grandchild. I know my parents and my in-laws both feel the same way, and it's frustrating. But again, I mean, if you were to get sick, that would be on your kids and your grandkids. So, think about it from both ends. We really have to be cautious with this. I think it's reasonable if you're generally healthy, as a grandparent or a parent, either way, to, if you're in the same household, it's different, but if you're a different household, if you are going to try to meet with your grandchildren or your children, really be at a distance. We have just recently done this with my parents and my in-laws, where we basically will meet them. We set up everything so that in the driveway, I tell my parents to bring their things and we have ours, and we separate probably close to 15 feet, but now maybe 10 feet is appropriate now with phase 1 reopening. I say 10 feet because let's remember, young children don't have a sense of that, and they are ready to run to you and they have a hard time stopping right at 6 feet. So just, give a little bit of room and maybe make it 10 feet in terms of how far you distance, bring your sanitizer, enjoy sitting with them at a distance and enjoy talking to them. And then what we do is, we do this when we see each other. So it feels like you're giving a hug, even though you're not. And I think it makes a big difference because psychologically, it doesn't feel right not to give a hug.
Yeah, the virtual hug, and then you blow the kiss, in terms of it. The time is coming to an end. It's really, time flies really, with all these things. The SSVT would like to request the survey that is being sent to all of you to give your frank feedback so we can, continue to improve. And we will come back again, and the need is there. Let me make sure. So it is very, very important. So thank you so much. And I will turn it over to Vasu for further final few words. Thanks again to the doctors, as well as to all the attendees for patiently listening. Vasuji?
Yeah, thank you, Dr. Shiva. It's a great session. On behalf of SSVT, we want to give our sincere thanks to all the doctors, Dr. Shiva, Dr. Chetana Rao, Dr. Revati Murthy, Dr. Anu Subramaniam, and Dr. Rao for answering questions and giving very useful information regarding COVID-19. It was helpful for a lot of people, again, as you can see by the number of questions we got. We want to also thank all the audience for attending the town hall. We will make the presentation available on the SSVT website. Video recording will also be available on the SSVT streaming channel. Please be aware of the live streaming of the pujas on the YouTube and Facebook. In the YouTube, the channel is called SSVT Streaming. Please consider to sponsor the pujas online. We have also started a service where you can perform archanas and personal pujas using Zoom connection. So we're getting very good feedback for the service. So please contact the temple for more details. Hope to see you on the live streaming. Sarve bhavantu sukhinah, sarve santu niramayaha, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Om Shanti Shanti Shanti. Namaste to all. Good night.
Thank you. Thanks, everybody.
Thanks.
Thank you all.